lots of questions in there, but the theme that everyone's asking about is what can we do? Citizen says, how do we do this before they fuck us all over? Though we can vote, but it feels like it'll be too late by then. So the theme in there is what are we supposed to do, Gary? How do we, do something? Can we do something, or do we just have to hope and pray?
I think in some regards, some things are too late. We've left this not for the 11th hour, but the 11th hour and the 58th minute. Private equity has moved into New Zealand in a big way, not just in healthcare, but in other realms. And these are really the vulture capitalists, or the modern day version of the robber barons, who go into a public service with some assets, and they sell off and they sell off and they sell off, and they underhire and understaff. They wring everything they can out of it and then leave it for dead because they've got the money they needed. They've got what they came for, and realize these people will leave. Shane Reti will probably go be a chancellor of some med school that he helped fund, right, through National. Simeon will go do whatever it is people like him do. These people will find roles in marketing, in business, in corporates. If you look at the number of people that work for Philip Morris Tobacco and British American Tobacco among, I don't know, just family and friends and employees of the current government, it is remarkable. We've got gun and tobacco lobbyists, or supposedly ex-lobbyists, in positions of power right now, right, as ministers and stuff. So it is too late. We are being eaten alive and consumed from the inside out. Is there a solution? Yeah, I mean, things can get better, I have to believe, because I understand that things can get even worse. We can devolve into an American style winner takes all, two-tier, uneven, unequal system. And that's what these guys in government are pushing us towards. Like I mean, it's in many Western democracies. Western democracies are fragile. The public sector is almost undefended, right? Union participation is weak and meager and meek, and limited, and has been constrained by legal challenges and other things. So there's very little defense, and they're almost ripe for the picking. It's like it's just it's like that jackal and the herd of gazelle. They're picking off the public sector right now. So what can we do? What I would say is do what you can. So Dunedin went out, and 30,000 people, like one of the largest public rallies ever, they said, hell no, this doesn't go. This is ridiculous. In my town, they've been rebuilding a hospital for like 20 years. For 20 years, they've said it's 7 years away. It's still another 7 years away. And they actually don't have any of the money set aside or dedicated to fund the last half of it. All the patient towers that are going to go up, which I think there's supposed to be 4 of them. This is where all the patients are going to be, the medicine wards, the surgical wards, all of that stuff. There's no money for that. There's no plan for that. There's no planning and design for that. There's nothing. It's going to happen in 2032, they assure us, but they can kick that can down the road endlessly. It might as well be a figment of our imaginations. They've got some steps of it going, a whānau house, a pediatric outpatient wing, $30 million for this or that. But and they have promises of getting to work on an acute services wing of an ED and an ICU in the next few years to become open on 2032. But I just heard a presentation on the numbers, and what do you know? The numbers when that hospital opens will be too small to accommodate the need of what we have right now. So you could open that hospital not in 2032, but today, and we could use those emergency rooms, those 55 patient spaces. Because I can tell you, there are times where the 32 beds in the ED are full, and there's 32 plus more patients out in the waiting room that we are trying to treat. So could we use that hospital right now? Yes, absolutely. But they haven't even planned for, let alone funded, the most significant phase, which is where all the patients are going to go, these patient towers. So yeah, it's a mess. What can we do? I don't know exactly, but I can tell you this: protest publicly, loudly, get out there. Do not make it easy for these politicians to get out of their car, to walk to their office, to have office hours at their office without sharing your opinion of what is going on. They need to actually have tangible, like it needs to have an impact on their lives for it to matter. And the only way you're going to do that is by affecting their ability to get power, to accrue power, or more importantly, money.
Mhm.
So I'm keen to hear from anyone's suggestions on how you target those two things, but I do understand that is what motivates them. It is not about my poor patients going out and picketing around a hospital. They've asked, like, it can in community meetings, should we do that? Should we picket at the hospital? And I say, do what you think is right, what in your heart seems right. But your tears, your suffering does not motivate these politicians to change their course of action. They are not like you. They are not motivated by human suffering and sadness. They are there for a reason, and they are maximizing corporate profits with every single action they take. I want you to look in the energy sector, in supermarkets, in banks, in your mortgage, and tell me if there is even one realm in which things have gotten better for you as a taxpayer or a worker, or whether all of those fields have gotten better for corporates that are profiting. And you know the answer, Pat. It's windfall profits, record profits, historic profits for those sectors,
Yeah.
and a decrease in the quality of life of my patients, of their ability to afford rent and to afford food and to afford medication and to get adequate and timely health care.